Hello everyone, welcome to my page. If you are watching me on TikTok or Facebook, if you are watching me on YouTube, I welcome you to my channel. Today, let's talk about how to avoid perineal tears and how to avoid episiotomy being given during childbirth. Before I go forward, what is perineal tear? Perineal tear is an injury sustained by a mother during the delivery of her baby in the second stage of labor, and it can be classified according to the degree of the tears from first degree to the fourth. What is episiotomy? Episiotomy is a deliberate cut given at the perineal site in order to widen the vagina canal to accommodate baby to be delivered, and it's being carried out by the attending midwife and your attending obstetrician during the second stage of labor. Episiotomy is not routinely given unless if the need be, but let's talk about how to prevent all these altogether. How to prevent vaginal tears and episiotomy cuts during your labor. The first thing is hydrate yourself very well. Hydration allows the skin to stretch, so this will be helpful during childbirth. Your skin will be able to stretch out. Take a lot of fruits, like fruits that contain vitamin C. This also maintains skin integrity, and it will allow it to stretch out during labor. You can also take fruits that contain vitamin E as well. This also promotes skin health, and this will be helpful during the delivery of your baby to allow the skin to stretch out. Another things that it can be done to prevent tears is pelvic floor exercise according to how you can tolerate it during your pregnancy, most especially towards the delivery of your baby. Another thing you can do is to engage in perineal massage, which is recommended from 34 weeks of pregnancy upward to the time you will deliver your baby. How to carry out perineal massage in order to avoid episiotomy being given during labor or to prevent perineal injury during the second stage of labor. Make sure you maintain an aseptic technique. This is a type of method you use to prevent any kind of infection to your genital area. First thing is for you to make sure that you wash your hand thoroughly. Don't forget to cut your nails so that you will not injure yourself. Urinate before you start. Pregnant women frequently pass urine, so by the time you are touching the genital area, so that this will not stimulate urination, so make sure you empty your bladder, urinate before start, take your bath as well, and maintain a comfortable position. You can lie on your back with pillow support, with legs bent and knee apart. Make sure you choose a position that is comfortable for you. You can maintain a side lying position whereby you support yourself with pillow, and your partner can actually do this for you. In order for you not to miss the area, if you are going to do it by yourself, use a mirror. Perineal massage is recommended to be carried out at 34 weeks of pregnancy till the time of your delivery. In continuation of the perineal massage, get a specific type of cream, preferably almond oil or olive oil. Instill it to the vaginal canal. Start from the U shape of the vaginal canal at the lower part of the vagina. That is the area near the perineal area. Apply pressure downward. Breathe deeply through the time you apply pressure to stretch the area, and this is done to accommodate baby's head at the second stage of labor. Breathe deeply when you press the area. Apply your thumb for 30 seconds to 1 minute, depends on how you can tolerate it. Then move to the sideways of the vagina. Try each thumbs on each side. Breathe deeply through the stretch for 30 seconds to 1 minute. Walk your way sideways. Then massage in U shape. That's vagina canal downward closely to the perineal area. Massage it in U-shape motion for 3 minutes to 5 minutes. Depends on how you can tolerate it. This can make you feel uncomfortable but not painful. So you can try it every day till you deliver from 34 weeks upward. Another important aspect that you must take into cognizance to prevent perineal tears or giving of episiotomy during second stage of labor is to listen to your healthcare provider. Don't push when it's not time for you to push. Have a control push. Although in the second stage of labor, you may feel the sensation to suddenly push the babies out, but listening to the instruction of your attending obstetrician and midwife to know when is actually for you to bear down. Another thing that can influence if you are going to have tears in the second stage of labor is positioning. Studies shows that the long age use positioning in labor, such as lithotomy, can actually influence tears in the second stage of labor in comparison to other positioning such as side lying and when a woman is on all four during the second stage of labor. I've come to the end of this video. Thank you for staying with me to the end, and as many expectant mothers that are watching me right now, I wish you a safe delivery, healthy babies to healthy families. Bye.